Myself Dr. Vinod, consulting physician and diabetologist, presently practicing in a Saptagiri Medical College and Hospital, Bangalore. So today's topic of discussion is hypertension. So hypertension and its etiology, causes, pathogenesis, what are the complications and how to control our blood pressure and how to measure the blood pressure. So we are discussing all these topics by today. So what is this hypertension? So India is a hub of hypertension, especially it's called as a silent killer because of its complications. So complications like a stroke, heart failure or renal failure or especially retinopathy, these are the major complications of the hypertension. So if you control the BP, we can reduce the complications. So what is this hypertension? Hypertension is nothing but that is pressure exerted by your heart or column of the blood on your heart vessels. So we usually hypertension will be measured in two major headings, especially systolic blood pressure and the diastolic blood pressure. What is this systolic blood pressure? Systolic matlab when the heart contracts, whatever the pressure exerted by the column of the blood, that is called systolic blood pressure. And what is this diastolic blood pressure? When the heart in between the contraction or relaxation, that is called diastolic blood pressure. So what are the causes of hypertension? Why so many Indians are suffering from hypertension and its related complications? What are the causes of the hypertension and what are the complications of the hypertension? Especially now presently we are discussing about what are the causes of the hypertension. Main cause of hypertension is our lifestyle. Especially most of the Indians are addicted to the sedentary lifestyle. What is this sedentary lifestyle? Not doing the physical activity, not doing the exercise, eating unhealthy diet, eating excessive of carbohydrate, eating excessive of the fat items. So that is the main cause for hypertension, that is our lifestyle. So that is an important cause for hypertension. And second important cause for the hypertension is our family history, because most of our ancestors, especially your grandfather, grandmother or your father, mother will be suffering from hypertension. Definitely 20 to 30% you will be having higher chances to suffer from the hypertension, that is genetics. So the hypertension causing genes will be in your blood, so those will be transferred to family and that leads to hypertension. So apart from this two important things, lifestyle and the family thing, there are some other causes like smoking. So smoking everyone knows, and most of the younger generation which is addicted to the smoking is one of the risk factor or one of the causative agent for your hypertension. Along with the smoking, your alcohol. So alcohol is also one of the major risk factors for your hypertension. So along with this risk factors, there are some other risk factors for the hypertension like your renal failure or heart failure. See, renal failure, heart failure are the complications of hypertension, but if the person is suffering from renal failure due to other causes, that leads to hypertension. So we discussed about what are the causes of hypertension. Then now presently we are start discussing about what are the pathogenesis. I mean what hypertension, if the blood pressure is rises, what will happen to our body. So that is especially we will call it as a pathogenesis, or else what are the complications associated with the hypertension. So just imagine you will be working in some field, suddenly you feel severe headache or suddenly you will feel the chest pain. So what it might be because of? Most of the time it will be because of your raise in the blood pressure. So what complications it will do? Just imagine there is a raise in the blood pressure in your blood vessels. So if blood pressure is increased in your blood pressure, that leads to excess pressure in your organs like your kidney, organs like your heart, organs like your brain. So if excess pressure in your heart, kidney or brain, what it leads to? That especially in heart it leads to heart failure, especially in the kidney which leads to renal failure, and in case of brain which leads to stroke, and excess pressure in your eyes, that leads to retinopathy or sudden onset of the blindness. So these are the major complications related to the hypertension. Now we should know, all the Indians, especially all the world population, we should know how to measure the BP and how to monitor our BP and how to control our blood pressure. Blood pressure is measured by the machine called sphygmomanometer. So sphygmomanometer, previously we had a manual sphygmomanometer, now we have a digital sphygmometer, especially patient can easily measure his blood pressure in his home. Once you measure the BP by the sphygmomanometer, you can record it down and you can show your concerned doctor. So that is how you have to measure the blood pressure. So once you measure the blood pressure, what is a normal value? And when you will call it as a hypertension, when you will call it as a elevated blood pressure. So I am educating you in such a way that you should know what is hypertension, what is elevated blood pressure, what is the normal blood pressure. So according to American Heart Association, we have some classification of the hypertension. What is normal blood pressure? When your systolic blood pressure is 120 mmHg and diastolic blood pressure is 80 mmHg. According to the American Heart Association, one systolic blood pressure is 120 mmHg, diastolic blood pressure is 80 mmHg, we will call it as a normal blood pressure. If the systolic blood pressure is 120 to 129, diastolic blood pressure is 80, then we will call it as elevated blood pressure. And in case systolic blood pressure is raised between 130 to 139 and 80 to 89, that is called stage 1 hypertension. And if systolic BP is more than 140, diastolic BP is more than 90, we will call it as stage 2 hypertension. This is according to the American Heart Association. What are the symptoms of hypertension? So everyone should know what symptoms the patient will be suffering from, and we have to identify you are suffering from hypertension or not. So main symptoms is headache, blurring of vision, or easy fatigability, or difficulty in breathing, or breathlessness, or decreased urine output. These are the major symptoms of the hypertension. So what are the important complications of hypertension? Previously I have explained, now in detail I am explaining what are the complications of hypertension. One of the most important complications of hypertension or raised blood pressure is heart failure. So what it will do, once the BP is raised, it will give excess pressure to your heart and heart is failed to contract. So that leads to heart failure. So once heart is failed, the patient will be having difficulty in breathing, chest pain or swelling in your lower limbs. These are the symptoms of heart failure. So second important complication is kidney failure, especially we will call it as acute kidney injury. So suddenly if the BP raises, that leads to excess pressure on your kidneys and that leads to acute kidney injury. So if the acute kidney injury happens, the patient will be having decreased urine output, or the patient will be having puffiness of the face or lower limb swellings. So this is second important complications of hypertension. Third important complications will be stroke. So if the blood pressure rises in your brain, that leads to stroke. So we have two types of stroke, especially in hemorrhagic stroke or ischemic stroke. So hypertension can cause both types of the stroke, hemorrhagic and ischemic stroke. And fourth important complication is sudden onset of blindness. So excess blood pressure, that leads to decrease the blood pressure into your eyes, that leads to sudden onset of blindness. So these are the four important complications of hypertension. Now why we are discussing, why we should know the hypertension, because previously I have explained it's called as a silent killer. So May 17th we are celebrating the World Hypertensive Day. So everyone should aware of the hypertension. So in this May 17th 2023 we have a dictum called measure your blood pressure, control it and live longer. This is a dictum of the World Hypertensive Day 2023. Previously we have discussed about the what is hypertension, what is the etiology of hypertension, what is the pathogenesis of hypertension, what are the symptoms of hypertension, and what are the complications of hypertension. And I have explained this year what is the dictum or what is the motto of the World Hypertensive Day 2023. So presently we are discussing most important topic is how to control your blood pressure. That is one of the most important topic to discuss. So how to control the blood pressure, everyone knows, especially we have to modify our lifestyle. How to modify our lifestyle? Briefly I will be explaining, especially exercise. So regularly every man or every woman or anyone in the family should exercise 30 to 45 minutes. That is called brisk walk. So second thing is reduce your obesity. Third thing is control your diet. So we have a particular diet for hypertension is called DASH diet. That is, DASH diet includes reduce salt consumption. How much amount of salt has to be reduced? So especially we have a particular number less than 6 grams per day. That is the dictum every hypertensive patient should eat a salt. So along with the reduction in the salt consumption, we should eat more vegetables and the fruit, and we should reduce the consumption of the carbohydrate and the fats, and we should eat a moderate amount of the protein. So this is about the DASH diet. So what are the other measures to reduce your blood pressure? Especially you should take proper medication. Once the doctor is prescribed for some medication, definitely you should follow the doctor's advice and you should continue to take the medication. So along with that, you should control your habits, especially if you are a smoker, you should quit the smoking. If you are alcoholic, you should quit the alcoholic consumption. So overall, I advise you, stay fit, stay strong, stay healthy, do regular exercise, especially to 30 to 45 minutes, that is a brisk walk, and control your blood pressure and avoid its complications. Thank you one and all.